Today we are going to talk about undescended testes, that is cryptorchidism. Incomplete descent of one or both of your testes, or you can say the bilateral testis, is called cryptorchidism. And then there is an ectopic testis. What is an ectopic testis? An ectopic testis, the testis is present outside of its normal path. This is a picture taken from Bailey 28th edition, and you can see here that these are showing some of the common sides of undescended testis. 15% of it is found in the abdomen, and 25% are found in the guanal canal, and most common is the high scrotal line, or you can say extra inguinal. Then these are some common sites for ectopic testis. There is a superficial ectopic, and this one is the most common one site. Understand? Okay, now let's talk about the some of the incidents. In full term, maybe the incidence of undescended testis is very less, as you can say the chances are only 3%. But if a person, or you can say if a baby is premature, then there are chances are very high, like 30%. And according to Bailey 28th edition, half of the, you can say one third of the cases, sorry, no, not half, one third of the cases will reach scrotum by 3 months of age, you can say 90 days. If they do not reach before 90 days, or you can say 3 months, then they are not gonna reach the scrotum, or you can say rarely. And the incidence of undescended testis at 1 year is around 1%. If you can see, like in full-term babies usually 3%, but at the age of 1 year it's only 1%. These are stats taken from Bailey 28th edition. uh, as per diagnosis, the patient usually do not present with the primary complaint of undescended testis. Usually patient present late, and mostly due to other complications, such as because of undescended testis there will maybe a patent processus vaginalis, and it can lead to hernia, and the patient may present at the age of 15, 20, 25 years due to hernia, or maybe testicular pain, or maybe acute torsion, because the torsion is quite common in undescended testis. And undescended testes are more common on the right side, but on 20% of the cases they are bilateral. As I told you about the sites, 15% of them is abdominal, 25% is inguinal, and 60% are high scrotal, or you can say extraclavicular, which is basically present at the scrotum neck. Okay. Ectopic sites are, as I told you, superficial inguinal pouch is the most common site. And which what is a superficial inguinal pouch? It is basically a pouch, you can say the testis is basically present at medial and inferior to superficial inguinal ring. If this is the superficial inguinal ring, it is gonna present at around this position. Understand? Inferior and medial. Okay. It is the most common site, and other some rare case sites include femoral triangle, root of penis, or peritoneum, as I told you in this picture. Okay. And microscopically the testis is usually same at the initially, but after 1 or 2 years histological changes started appearing. Sertoli cells, Leydig cells, and spermatogenesis is going to be affected, and ultimately and if the patient is present at puberty and the orchiopexy is not done, orchiopexy, or you can say the correction is not done at puberty, the patient usually present with an azoospermia. Fertility is very affected. If a patient has only one testis affected, then the fertility rate will be same as a general population. But if it is bilateral, then the chances of fertility is 38% higher than the general population. And if the orchiopexy is done after puberty, patient is gonna mostly presented with azoospermia, or means no sperm production at all due to histological changes, as I told you. And before, if the orchidopexy, or you can say the correction is done before, it can improve the chances of fertility. Malignancy chances, If the orchidopexy is done before puberty, the chances of developing a carcinoma is 2 to 3 times higher than the general population. Or if the orchidopexy is done after puberty, then the chances are like quite much higher, like 5 to 6 times the general population. And in most of the cases, the seminoma is isolated, and after orchidopexy, the chances of seminoma even decrease, like 30% of them are seminomas. Peak age of seminoma in these patients is around 15 to 45 years. Early cure has a good, if the patient has been caught early, then the prognosis is very good. And 90% of the patient do have a potent process vaginalis, as I told you, and they are more prone to develop torsion. And after that, Billy does have a picture of, or you can say picture. I'm sorry, I'm sorry to say picture. There's a paragraph called clinical features. In this clinical features section, the Bailey has talked about this thing: retractile and true and undescended testis. And what is it? Retractile testes are those testes which has descended once and has gone back. This is done usually due to cremasteric reflex, or you can say the cremasteric muscle stimulation. And in this, the patient usually examined in the relaxed supine position, retractile. Testis in the guanal canal. When cremasteric skin is touched, it can lead to acquired undescended testis in 2 to 50% of the population. In 2 to 50% of the cases. So you do need to have regular checkups for these patients, because they can develop unacquired undescended testis. Understand? And a true descendant is undescended testis is that one which has never come down. Okay. After that, let's talk about the investigations. Ultrasound has a very good investigation, and you can say ultrasound has a very good investigation. You can see, but ultrasound do have a limitation in, as only 45% sensitivity in localizing non-pebble testes. Usually the testes are present in the superficial, as I told you, is present very superficially around this point now. But sometimes then it is not palpable, then the sensitivity of ultrasound is very low. CT scan is usually avoided due to radiation. MRI is quite good, but MRI do require anesthesia. So if we are going to give an anesthesia, so why should we not do just laparoscopy? That's why the laparoscopy has ultimately become the gold standard in these conditions. As well as, according to Bailey, no radiological test can 100% identify if a testis is absent or not. And that's all, guys. This is about the undescended testis. This topic is entirely from uh, Bailey, as from the 28th, the latest edition. And if you do want to read this topic again, you can do it. And in the next video, we're going to talk about orchidiopexy.